The tibial femoral joint, tibial tuberosity, and the popliteal, and make sure there is no fluid felt. Let's do the other one. The tibial femoral, the tibial tuberosity, and the popliteal. Okay. Strength of the knee. I want her to bend her knee and I want her to push against me. Okay. And checking the strength of the other one at the knee joint. Okay. Good strength. Look at her tibia and her femoral and make sure there's about a 15-degree curvature, and there is in both of her legs. Now, and I know that she has prominent heels and ankles. She has all of her metatarsal joints or phalanges are present. Towards your head is flexion, dorsiflexion, and then down is plantar extension. Bring them in towards you is inversion, and then take them out, tilt them out this way is eversion. Outward this way, that's abduction, and bringing them towards you, pointing your toes together, is adduction. Gas pedal for me, against me, okay, very resistive, and then bring them up towards your head. Okay, very good. Good muscle strength. On to the neuro portion. Her demeanor's very pleasant. She's erect. To determine your orientation status. Who won the election?
President Obama.
And what year is it?
2012.
Okay, and what year were you born?
1974.
And your full name?
Amber Renee Paul.
Okay, very good. So her orientation is she's oriented times 4. It's your memory, okay, and your judgment. So we're going to do your state of consciousness, and we're going to ask you some questions like, cat is to kitten as dog is to
puppy.
This is testing your arithmetic, and then we'll test your ability to write. And we're going to start with the number 20, and I want you to subtract by 4 until you get to the number 8.
Okay. 16, 12, 8.
And let's have you write your name right there. And now memory. These 4 of the 5 I gave you. 7, 16, 14, 13, and 10.
7, 16, 14, 13, and 10.
Judgment. If you were walking along the street and found an envelope lying in the street and it had a stamp and an address on it, what would you do with it?
I'll put it in the mail.
Very. Cranial nerve 2 is the first one, which is the optic nerve. I want to hold this over your eye, and I want you to look at our chart out there and identify the smallest letters that you can see and just say them out loud.
E, F, P, T,
okay. Okay.
O, E.
Very good.
E, F, P, T, O, E.
Very good. A confrontation test. Coming in towards you to wiggle.
And Sam.
Okay.
And Sam.
Nerves 3, 4, and 6. We'll look for accommodation of her pupil. Pupils are at risk, and they did accommodate. Same on the field of gazes. So don't move your head. Okay. They're going to test cranial nerve 5, which is the trigeminal nerve. And I want you to just clench your teeth together, okay? And make sure there's no twitches or anything happening or muscle movement on her face, and there is not. Cranial nerve 7 and 9, the facial and the glossopharyngeal. And with this one, I want you to smile, but don't show your teeth. Okay? Puff your cheeks out with air. Okay? Raise your eyebrows and wrinkle them down like you're frowning. Very good. And now show your teeth. Very good. Now close your eyes. Okay. I've also noted that she has no eyelid falling down like a ptosis on her, and her movements were equal as she did those taps. A flavor to it. So I want you to see if you can taste and tell me what the flavor is. It's really not.
Salt.
Check the acoustic nerve, and this is number 8, and I'm going to do the Weber and the Rhine test. So first of all, I'm going to hit this, and I want you to tell me how long you can feel the vibration. Okay?
Split.
Okay, that was 8 seconds. Okay, now I want you to tell me when the vibration stops, and then I'm going to put it to your ear, and then you tell me when the sound stops. Okay?
Okay, the sound just stopped. There.
Okay. You were 12 on the bone, 12 seconds on the bone, and you were 23 seconds there. Nerve 9 and 10, the glossopharyngeal. And then we're also going to check the hypoglossal following that, number 12. I just want you to open your mouth and say ah, and let me see your uvula. Ah. Okay, very good. And it's midline from side to side. Very good. Okay, has a gag reflex. She definitely has a gag reflex.
L, T, D, and N.
Very good. So all of those cranial nerves are normal. Cranial nerve 11 will have her shrug her shoulders. The Romberg test, I want to have you close your eyes, and I want to make sure you don't sway. It's normal to sway at times, but not drop to the floor. Okay, very good. You can open your eyes now. Okay, very good. And then come backward. Okay, and then I want you to stand on your toes. Okay, and then go back down and stand on the back of your heels. Okay, bend your knees down, shallow bend. Okay, very good. So I'm going to have you hold your hands on your knees, and I want you to do them up and down real fast. Very good. That's normal. Very well. Now I want you to take your right arm and touch my finger with your... Okay, do it again and make it faster. Okay, all right, very good. Now hold your arms straight out at your thing and touch your nose with the tip of your finger with your eyes closed. Something in your hand, and I want you to identify it, so close your eyes and tell me what that is.
It's cotton ball.
And I want you to point to where you touched, where I touched. Okay, very good. Okay, that is normal. Now you can open your eyes, and we're going to go between sharp and dull. And I want you to point to where I touch you, and then I want you to tell me whether it was sharp or dull. Okay, so close your eyes.
It's kind of dull.
Dull? Okay, now this is sharp, this is dull.
Okay.
Okay.
Then that was sharp.
It was sharp? Okay. Let's do it again.
Sharp.
Okay.
Dull.
Okay. That's tactile discrimination. Okay? Okay. Very good. Now we're going to check a position sense. And I want you to close your eyes. And I want you to tell me if I have your toe up or down.
Up.
Okay?
Down. Up.
Okay, very good. Now I'm just going to move to your fingers.
Up.
Okay?
Down. Up.
Okay?
Down.
Okay, very good. Those were normal. And I'm going to touch you with 2 different items, and I want you to tell me where I've touched you, and did I touch you with 1 or 2?
Okay.
Okay? Close your eyes.
1.
Very good.
1.
Okay?
1.
2. Checking her reflexes. Oh, there you go. Oh, okay. Okay, the tricep. Okay, we're going to check her patella. Okay. Okay. Okay, very good. We're going to do the plantar, and this is called the clonic. Okay. We should not see toe flaring. Okay. Very good. Very good. Normal reflexes.